Good morning, I'm Simone Varca. I'm a trainee doctor at Policlinico Vergata, University of Roma Vergata. And today I'm pleased to introduce you our study about treatment used and adherence to treatment in multiple sclerosis patients. We know that multiple sclerosis is the most common neuroinflammatory disease. And talking about neuro-urological symptoms, around 80% of patients manifest them after 10 years from the diagnosis, but also 10% of patients manifest them at disease onset. The most common symptoms are storage symptoms, but also voiding symptoms, as you can see here on the right. What do we use to treat these patients? Well, we can use a pharmacological therapy, antimuscarinics, alpha blockers, beta agonists. We can use clean intermittent catheterization, but also pelvic floor rehabilitation. Or we can use a second-line treatment like botulinum toxin injection or tibial nail stimulation. But despite guidelines recommendation, there are only few studies about multiple sclerosis patient satisfaction on the use of this treatment, and there are even less studies about patients' compliance. So, the aim of our study is to understand what is multiple sclerosis patient response and adherence to different medical treatment for LUTS. We enrolled 47 patients. We recorded age, sex, type of symptoms complained, previous treatment, data related to CIC, and proposed treatment. We create a database and analyze the data. In order to analyze patient satisfaction, we use a simple Likert scale, a scale from 1 to 5. 1 means very dissatisfied, 5 means very satisfied. And whenever patient refused or dropped a treatment, reason and motivation were recorded. So here are the results. As you can see, 9% of patients prefer not to start any kind of medical treatment. People who used a medical treatment for overactive bladder were fully satisfied in 7 cases, 18% of our population. 30% of our population, 12 cases, were partially satisfied. 6 patients did not notice any changes. 7 patients, another 18% of our population, were not satisfied of treatment, and 20% were very dissatisfied. We have not found difference between males and females in our study. But I think this is the most interesting part of our study. At follow-up, almost 60% of people were not undergoing the proposed treatment. Everybody will wonder why. Well, the most common cause is related to side effects. 30% of people. Let's think about xerostomia, xerophthalmia, constipation due to antimuscarinics. 19% of people report no efficacy at all of treatment. 26% of people stopped treatment because they didn't want to pay by themselves for the drugs or because they think they are already taking too many drugs. And another 26% of people refused any kind of medical treatment. So in order to summarize, I think that we can say antimuscarinics are the most common treatment for overactive bladder in multiple sclerosis patients. But a satisfactory outcome seems hard to obtain for this patient. First of all, because of side effects, but also therapy itself may represent a burden, even in presence of positive results. So the message is that we need to design a tailored therapy for each patient. And we can also try with closer follow-up in order to improve the compliance. Thanks for your attention.